Thank you for joining us again here on our 3 p.m. daily chat, where we're coming to you every day and giving you an idea of what's happening in Chatham-Kent. Your TV is hosting this every day, so I hope that you're able to join in. Today, I have Linda Reaume. Linda is the president of the Labour Council, and Linda also sits on United Way's board of directors. So welcome, Linda. Thank you very much for joining us today.
Thank you for having me.
How's it going at home, Linda? I know that you're working from home, like many of us.
It's pretty good. I have my daughter and my little granddaughter is 9. She lives on the property, so we see them. They're eating me out of house and home, but it's good. We're managing, and I got my husband stuck at home for 2 months, so he finally did my master bathroom.
Well, good. There's some blessings that are coming out of this. Linda, can you touch on what the Labour Council function is, just so that our viewers have an idea?
Okay. I would describe the Labour Council as a working man's chamber of commerce. We have a board made up of members from almost all of the unions in Chatham-Kent. We meet monthly, and at these meetings, we discuss their affecting each and every affiliates. We discuss community action. We discuss community news, if there's anything we can do to help, or if we need to maybe do a rally to support someone. We also take on issues that affect our workers. And not only our workers, but all the workers in our community. I can give you an example of that would be, we've been rallying for our healthcare system, things like a living wage for all workers. And we also work very closely with United Way and help them when they need our help. And it's a very, very good relationship.
Certainly, we have an excellent partnership, and without the support of labor in general, United Way really could not be making the impact that we are on the community. So shout out to labor there. And speaking of, COVID-19 is affecting all people in one way or the other. And as far as labor goes, can you talk about, Linda, how it may be affecting specifically the people that are out of work?
Done a lot to bring labor in our community together, because some of the things that we have been fighting for years are now at the forefront. And I think the community is starting to understand more why we have been fighting for things. And I'll give you an example. We have been fighting for a living wage for PSWs working in long-term care facilities for a long, long time. And now with COVID, these PSWs have become very essential workers, along with, of course, the nurses. There are so many people that people are understanding they were not looked down upon, but they weren't up there in the big hospital jobs, or, they're the people that come behind you and scrub the floor. There's a lot of essential workers that are underpaid. What my concern was with the long-term care facilities have not only had workers that are underpaid, but they're understaffed. So this doesn't give them the opportunity. If I go into a long-term care facility when I get that age, and I'm not that far off, trust me, I want to make sure that there are people there that can come and sit in my room, talk to me about my family, or read me a book, or look at my pictures and make my life while I'm there as pleasant as it could be. These people right now have not had time for that in a long, long time. They're actually very lucky if they can get their beds changed and their diapers changed, and that is a shame. So COVID has brought to the forefront the importance of not only the people themselves, but the number of people that they have. So it is very heartbreaking when you consider that our old folks and our young children are looked after by workers who have never been respected for what they do. So that is part of what we've been battling. Privatization in these nursing homes has, because it's made them for profit businesses now. All of us, the Canadian Labour Congress, our Labour Council, the Ontario Federation of Labour, we're all fighting. And of course, with workers laid off, our local unions are not receiving dues. So, yes, I know a lot of places are struggling money-wise, we as well. So now we have a president who is struggling to continue to service members, even though he's not considered essential. And not only the members in our locals, he is also working within his community. I know some of the ladies that are working for their locals are working in our community here. So just because we're not in the local union offices does not mean that we are not still out there serving our membership and all the folks in our communities.
That's actually a really good point, Linda, because I think that there's a misconception, not just with Labor Council, right, with all kinds of services that folks are thinking since the province shut down, that it's not available to them, and that's not the case. There's all kinds of supports that are still up and going. So what about the folks that are working still? I'm sure that you mentioned PSWs, and that kind of hits home for me. If, my dad's in long-term care. We also get extra support because I know that they're already short-staffed. And so we actually hired a PSW privately, which unfortunately now with COVID, she can't even get in to see my father. So really, they're taxed beyond measure. And I truly hope that one of the blessings that come out is that they are compensated properly for the work that they're doing. So that does hit home for me. So going back to the folks that are working, some of them are working in environments that may be higher risk, like rest homes and hospitals. And some of them are working in plants that they're now doing something a little bit different, like whether they're now, instead of doing their normal routine, they're making PPE or whichever the case. But anyhow, back to my point about the folks that are working, how are they being supported? Because like I said, when they're leaving their house to go to work, I'm sure that they have their own concerns of safety, right?
Yeah, we do have a couple of plants right now that are just ramping up to open up to produce what they normally produce. They're not doing PPEs. And apparently they have spaced out as much as you can on a production line, the plastic between workers as much as you can. I have serious doubts whether you're going to be able to practice social distancing the proper way once they get back to work. But folks do want to get back to work, and I understand that. But, this government has always been more reactionary than proactive. And a lot of the things that we as labor folks ask for are pretty much ignored until a crisis like this comes along, and then they say, oh, wait a minute, So I'm hoping with all of this and with our workers being slowly sent back to work, that the government pays attention to some of the things that we have been trying to tell them for many years. Health and safety is our number one priority with our workers. And if health and safety is not being followed to the extent that the government has said it needs to be, which is the social distancing, 6 week apart, PPE equipment provided, then we're going to have an issue with it. But we have people who, like, truck drivers, housekeeping. Yes, we have the nurses. Yes, we have the PSWs, restaurant workers, all of those folks that have worked through this pandemic. I feel they were never really recognized for what they do. And now they are getting the respect that they so justly deserve. But respect is not enough. We have to take a look at the conditions they work in, and we have to make changes, because this pandemic may or may not come back. And I'm at a point in my life where I'm not feeling that it's not going to come back. So when I look at what's happened in the United States, the number of deaths there is heartbreaking. The government, the federal government, has really done nothing to bring the country together. What I see happening here in our community is we have all banded together to help each other out. I don't see that happening there, not like we do here in Canada. And I'm certainly hoping that maybe the government will be smart enough to keep the borders closed because it's not safe yet. I had a friend I worked with for 20 years in Michigan, died yesterday of COVID. He had been sick and tried to heal himself, basically, till it got to a point where his wife said he had to go in. So his son came and took him to the hospital. His son drove away and died that day of COVID. No symptoms, had a heart attack caused by COVID. His father died yesterday, never knowing that his son had died. So, I think there's definitely some changes that have to be made, but I can only say that the folks that we have here who are saving our lives, who are scrubbing the floors and making the hospital safe for you to go in, please don't hesitate to go into the hospitals if you're not feeling well. The people making our food, the people bringing our food, we are so very grateful for them.
Thanks, Linda. And first I want to start off with I'm really sorry for your loss. That is a double tragedy for that family, and that's just it's a really sad story. The beginning of our conversation, I had asked you what the function of Labor Council was, and our video got a little bit delayed. Could you just touch on it really quickly? I'm sorry. I want to make sure the viewers understand what the function of Labor Council is, because it's important.
I guess I started with trying to compare us to someone else, and I said I see the Labor Council as the working man's chamber of commerce. We have a board of directors made up of heads of or a designated representative of almost every union we have in Chatham-Kent. We meet monthly. We discuss issues that may be going on in each of their own unions. We get a little report from them on how things are. And we also look at the community and what's happening in the community around us. If there is something like there has been, we've been involved with the Ontario Health Coalition, fighting to keep our healthcare, not allowing the government to cut, not allow privatization. We don't want that. We want to fight for our workers to have healthcare as it is. If anything, they can make it better, but when they start tearing it apart, we're in deep trouble. And we don't only do this for our members, we do this for all members of our community. And certainly people are welcome to join us at any point.
Thanks, Linda. You and I have had a couple of presentations together, and I can say from my experience with you, you're a very fierce advocate when it comes down to labor. I enjoy, your presence on our board of directors. So thanks for joining us today and enlightening us as to what the Labor Council is here for and is doing right now, and especially in response to COVID-19. So thank you, CK, for joining us today. Please keep in touch with us and make sure you join in on these 3 p.m. talks. If you have any questions, please, send us a private message and we'll make sure that we address it. And finally, if you want to get help, give help, or to donate, please visit ckgives.ca. And finally, thank you, Your TV. You've been a really good friend through this all.